The different types of heart failure are classified on the basis of imaging, such as echocardiography or magnetic resonance imaging. And we're looking at how well the left ventricle, the main chamber of the heart, is pumping. So if that pumping is reduced, we call that heart failure with reduced ejection fraction. Ejection fraction is a measure of how well the left ventricle is pumping. And there's also a form of heart failure where the pumping is preserved. It's not reduced, but the way that the heart relaxes in between each beat is actually where the problem is. So there's preserved ejection fraction and reduced ejection fraction. Heart failure is treated by, first of all, medicines to reduce the fluid that may have built up on the legs and in the lungs, to relieve symptoms, most commonly of shortness of breath and fatigue. But the real advance in the last couple of decades in particular is that we're able to change the long-term outlook, or what we call the prognosis, with 4 different classes of medications. And what we do is we are trying to reduce the workload of the heart so that it can recover. So there's reducing the heart rate, there's reducing the blood pressure and the workload on the heart. And then there are medicines which seem to help the heart muscle recover. So there are at least 4 different classes of drugs that we have. On top of that, we're also working to reduce the risk factors which lead to heart failure in the first place, such as coronary heart disease, where you've got narrowings of the arteries, and that may be treated, for example, by stenting or by taking tablets to reduce the cholesterol level, to reduce the risk of having any more furring up of the arteries. But there are other risk factors that we can treat as well. So that prevents the risk factors for heart failure in the first place. When people have heart failure with reduced ejection fraction, so that's the form of the heart failure where the pumping is significantly reduced and they have a problem with the conduction system of the heart, the way that the electrical impulses within your heart lead to the pumping function, when that is also a problem, those 2 things together indicate that you need to have a pacemaker and a defibrillator. And in some instances where there's just the reduced ejection fraction, you might need an implantable defibrillator. But that is a decision that's made by your heart failure consultant in combination with other cardiologists. So it's what we call a multidisciplinary team discussion. And there's good evidence that these devices, again, lead to improved survival and reduced hospitalization in the long term. Heart failure has many risk factors and underlying causes, most commonly coronary heart disease, where there's narrowings of the arteries, hypertension, which is high blood pressure. It could be due to heart rhythm problems, such as most commonly atrial fibrillation. It could also be caused slightly more rarely, but still significantly, by inherited problems with the heart muscle itself. Now, lifestyle disease risk factors such as diet, such as smoking, such as taking more exercise. These are factors that affect all of those underlying heart conditions. They also reduce the risk of obesity, diabetes, which also put you more at risk of heart failure. So if you like, you're reducing the causes of heart failure. And if you already have heart failure, then you're reducing the chance of it getting worse or of getting other heart diseases, because people with heart failure typically have other risk factors that need management. So we can't just look at the heart failure in isolation. Heart failure, at its most severe, has a survival over 5 years that's comparable with certain cancers. So so the outlook is serious. The good news is that, as I say, in the last 2 decades, there have been major advances in the treatment that we can give to people to improve survival, reduce hospitalization, improve the quality of life. And also, we are better at detecting it in the first place. So the message is that if you have symptoms of breathlessness, if you have symptoms of leg swelling, if you have symptoms of palpitations or chest pain, then please get assessed. At least let's rule out heart failure. And if you do have heart failure, there's lots that we can do about it.